In the spirit of reconciliation, the ECCV acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. And I also pay my respect to their past, present, and their elders. Thank you so much, Shivani. The Ethnic Community Council of Victoria, ECCV, is a member-based peak body representing the independent voice multicultural Victoria since 1974. ECCV has been advocating for human rights, freedom, respect, equality, and dignity for migrant and refugee communities. We strive to strengthen and build capacity in our communities through advocacy, policy, and leadership, empowering people from culturally diverse backgrounds. And our vision is to build a culturally diverse and harmonious society that is just fair and inclusive for all Victorians. For some housekeeping rules for tonight, please kindly keep yourself on mute if you are not speaking, and kindly put your phone on silent. And at the end of the session, there will be dedicated time for question and answer. Question can be written in the chat box as well. Before the community outreach program, I would like to just inform you today's purpose of the session is to share information regarding COVID-19 and vaccination from reliable resources and medical professionals. Tonight's session will be running approximately 2 hours, and thank you so much for all of you attending tonight's sessions. And the community outreach program, we are a team of community bilingual workers from various ethnic backgrounds, and we speak Arabic, Chinese, English, Hindu, Punjabi, Somali, and English. And our aim is to engage and support people from cult backgrounds impacted by the COVID-19 pandemic, and to empower members of multicultural backgrounds to make a well-informed decision about the COVID-19 vaccines. And content of presentation, guest speaker introduction, presentation from guest speaker, question and answer session, how and where to get the COVID-19 vaccines, resources and references. Today's our guest speaker is Muhammad Muhaddin, is the head of priority communities engagement in the COVID-19 vaccination program. Shivani, if you don't mind, can you please show me on this slide the notes? I can just talk about Muhammad's background, please, because unfortunately I can't see my screen properly. Thank you so much. Muhammad is a microbiologist and professional member of the Australian Society for Microbiology. He has also been an academic in the Department of Microbiology, Monash University, for over 20 years. He is originally from Sri Lanka and has been the immediate past president of the Islamic Council of Victoria, and he is also the current deputy chair of the Faith Communities Council of Victoria. He is a recipient of the Order of Australia and is a current Justice of Peace. Please, you are welcome, Muhammad.
So, Muhammad, I'm stop sharing and then you can share.
Yes.
Yes.
Thank you.
Thank you, Shivani.
Thank you, Susan, for the lovely introduction and warm welcome.
You are welcome.
Good evening, everyone. And thank you, Hayat, for organizing this as well, working in the background. I also have my colleague, Pasu, who's a senior advisor in the department. I think Aurora was supposed to join. I'm not sure whether she'll join us. So we'll have two people, and we'll try and post some of the information up on the website for you as we move forward. The presentation is going to be very, to give you an idea about COVID. It's also talking about the vaccines and also to address some of the concerns that people have with regard to COVID as well. So just give 2 seconds. So Also like to begin by acknowledging the traditional owners of the land we meet on and pay my respects to elders, both past, present, and emerging. I also would like to pay my respects to any elders who are here with us in this gathering as well. So we always talk about COVID. We hear so much for the last 2 years. We have been only talking about COVID. It's been front and center of everyone's mind. Just to give you some idea about how COVID virus targets the human body. So in most cases, people will have a very mild to moderate respiratory illness. It targets your lungs. So like any other respiratory illness, you can recover. But in some cases, it can lead to pneumonia. It can also lead to acute respiratory distress syndrome where people then find difficult to breathe. They have to go into hospitals where they are put on with oxygen. And some people, it might be so severe that they would need to be in the ICU with intubators. So where they put a machine like tubes down your throat into the lung region to help you breathe. And unfortunately, sometimes this can also lead to death in certain people. The virus in general can cause damage to your lungs as well as some of the organs. And this is what we are seeing now as some people who have recovered from COVID. It's termed as long COVID. They're seeing the after effects of COVID where people are still finding difficult to breathe properly. If they do a little exercise or walk too much, they're also finding problems as well. We also carry a lot of microorganisms like bacteria and all that with us. These are part of our normal microflora. As long as our organs, everything is intact, they don't cause any harm. But when a virus attacks, sometimes you can get secondary infections as well. We know the virus is spread from saliva and discharge of the nose. And this is why we always recommend people when you cough or sneeze, even if you have the flu or cold, please cover your nose because every time you sneeze and cough, we release a lot of these virus particles and people around us can easily pick it up and get infected. Now with this virus, sometimes it will manifest and people will see symptoms in 2 days, but sometimes it can take as long as 14 days for symptoms to be seen. So this is why if you have been in contact with somebody who has COVID, or you have been to a site where a COVID infected person has been there, you are asked to test and quarantine for 14 days. Sometimes when you test on the first day, you might not show you won't show any symptoms, or you won't give a positive result. So it is over that period of 14 days that the virus starts multiplying and also causes the symptoms to appear. And this is why when people come from overseas, at the moment, there is a quarantine period of 14 days so that we can make sure that people who are coming here are free of COVID, and then they can go back into their community and into their families as well. Because some people also can be asymptomatic. They can be carriers and they can spread the virus to other people. This is just to give you an idea of the number of cases since the beginning of 2019, late October, when we heard about COVID. There's been over 220 million cases around the world. Unfortunately, about 4.6 million people have died since then. It's roughly about 2.1%. If we look at the Australian stats, as of today, it was 63,154 cases we have had in Australia. Since yesterday, there's been an increase of 1,545 cases. From yesterday to today, the increase is 1,545. We have had since as of yesterday, the total number of deaths over the period is 1,044. And yesterday, from yesterday to today, there's been an increase of 6 people dying as well. So you can see this is not a simple like your normal flu or normal cold. This can cause a lot of harm. It can spread very easily, and this can also cause death in people. So in Victoria, it was recorded today, you had 246 new cases in Victoria, and we are trying to get people vaccinated, and all of them are from the Delta strain. We have had over 1,000 COVID exposure sites. This is where people who have infected have gone into various places. Unfortunately, they unknowingly or knowingly have gone in without getting tested and quarantined. So they have then exposed other people. So this is why these exposure sites are important. If you have been to one of those places, please get tested and quarantined. Our health minister mentioned that 87% of the active cases of COVID at the moment in Victoria is all under the age of 50. So you can see there's a shift in the age groups as well that are getting infected. Like there is over nearly 80 cases of children below the age of 10 who have been infected as well with this particular Delta strain. So of the 1,786 cases, active cases, 110 people are in hospital, 30 people are in ICU, and 14 people are on ventilators as well. Sadly, over the last week, we lost 3 people in this outbreak, but overall, we lost about 800 people last year, mainly in aged care facilities as well. So in this outbreak, we have lost 3 people. So when we talk about vaccines, we don't just talk about, when we talk about keeping people safe, preventing the spread of disease, we don't just talk about vaccines. Vaccine is not the only answer. It is the COVID safe behavior that we need to have. So we need to wear masks. We are told to wear masks when we go out anywhere or when we go to any indoor places, because this will prevent you getting the virus from other people. This will prevent, if you are sick, this will also prevent you from spreading the virus to other people. We also ask you to continuously wash your hands. So for example, when you go to the supermarkets, if you were to go and take a trolley, there is those wipes that you can take, grab a wipe the handles of those trolleys before you use it, because you do not know who has been there before you. It might be a person who has been positive, who has not bothered to take any care. So the virus particles could be on those trolley handles. And this is why we must continuously wash our hands as well, if you've been to any site when you come back, because human beings generally touch their nose or eyes every 3 minutes. This is the scientific evidence. They've done a lot of studies that people constantly will touch their nose or eyes. So you can work it out for yourself, whether you're one of those people who do that, but this is very common in people. The other thing is that you, wherever you go, you do the QR coding. The QR coding is not to police you or to check on you or where you have been or where you have not been. It is to help the contact tracers. For example, if you take off the shopping, if you take the supermarket, if a person who has been sick with COVID has gone to that shop, been there for a few hours and walked around everywhere, if you have been there at the same time, this would help them check with you, tell you to get tested and quarantine, because you then become a primary close contact. So it's important to QR code. And then when we look at, we are in the flu season and we are also now in spring, which is the hay fever season. So some of the symptoms for COVID is very similar to the flu or to the COVID. You can have a sore throat, you can have cough, you can have a runny nose. For flu, you might have fevers and chills. You might have shortness of breath. With COVID, one of the extra bits that we know is people who get infected with COVID, they also have a loss of smell and taste. So if you have any symptom, please don't consider it to be the flu or hay fever. Please get tested. Because if you get tested, and when you are testing, and if you're just testing because you've got any of the symptoms, and if you are working, you're doing casual jobs and you lose your income, you can apply to Centrelink and get their $450 given to you for the time period you quarantine. If you have been to one of the primary sites, tier 1 sites, you must test and quarantine for 14 days. So you get tested on day 1 and you get tested on day 13 as well. So people, again, if they are working casual work where they depend on a daily wage, they can apply for special allowance, which is $1,500 for the 2-week period. And that will be provided to you through Centrelink if you're eligible. So it's important, whatever happens, that you get tested and stay at home when you're asked to quarantine. Now the vaccination and testing is free to every single person on Australian soil. Even if you are a citizen, if you are a resident, or if you are visiting Australia, or sorry, if you're visiting Australia, or sorry, is somebody not muted? Or?
Yeah, if you are not muted, can you please turn your microphone off? Then we can hear Mohammed clearly.
Thank you. So if you are,
Or Shivani Hayat, can you please mute
I do,
participants? Thank you.
but if I do, I will.
No, I
Chances
think,
maybe.
I think you have to mute all. The organizer can mute all, and then Mohammed can open.
thank you. Yeah. So the vaccine and testing is free for every single person on Australian soil. Whether you be a citizen, a resident, you are visiting family here, or you are a refugee, international student, everyone can get tested and everyone can get vaccinated free. There's no discrimination between anyone who is on Australian soil. So I think I wanted to stop and start again. Sorry, it's sometimes it happens. So in Australia, we have at the moment given over 21 million doses of vaccines as of today. In Victoria, over 5.4 million doses have been given as well. So worldwide, 5.46 billion doses have been given. There are about 17 different vaccines, COVID vaccines available. So this is the full complement, and they say about 40% of the population as at least have one dose worldwide. So if we were to look at the virus and some of the information, this is referred to as a coronavirus because of the structure where on the surface you have these spike proteins which looks like a crown. This belongs to the same family called coronaviruses, which you have heard a few years ago we had SARS. There's an outbreak of SARS. I remember when we were traveling through Singapore, you'd have to go through a heat sensor. They would check for your body temperature. If you had temperature, then you would be put in a hospital in a ward. So we also had in the Middle East, there's a thing called MERS. So they all belong to the same family. We have two vaccines in Australia at the moment being given to people. One is the Pfizer vaccine, or is also commercially referred to as Comirnaty. This is an mRNA vaccine. There's no any strain involved. It's the mRNA that is being given. This technology is not new. Lots of people say this is something new. This is not new. Since 1961, people have been working on this mRNA technology. We also recently, a few years ago, it was used to treat Ebola. There was an outbreak of Ebola in Africa. This was mRNA vaccine was used. Ebola vaccine was an mRNA vaccine. We have the traditional vaccines that we normally would have. And this is the Vaxzeverica. This is earlier we know it as AstraZeneca. I'll refer to it as AstraZeneca because today they've got the new term. It's a commercial term which is accepted internationally. So this is your traditional vaccine. So whether it be your flu vaccine, many people take the flu vaccine. When you're as a child, as a baby, we take a lot of vaccines. They're all based where they use a strain that is not harmful. They get the DNA material from about this virus. This is all injected. So once how the vaccine works is when it's injected to our body, it then makes the body produce the spike proteins. It's not the virus it produces the spike protein. So immediately your body immune system gets started, it produces the antibodies. So the antibodies target the spike proteins and destroy it. But what happens is the human brain keeps this information in the memory. And if you do then get an infection of COVID, it will then release these antibodies and target them. Now, we must remember that the vaccine is not 100% foolproof. This is why I was talking about other safe measures. It has about, after the second dose, it has about 90%. So you can sometimes get COVID after being vaccinated, but it will be less than the normal infection that you get. Australia has also purchased 2 other vaccines. One is called Moderna. The commercial term is Pivax. It has been approved. We should get Moderna doses very soon, by middle of this month or end of this month. It will be most probably given through GPs and pharmacies. This Moderna vaccine is very similar to the Pfizer vaccine. It's an mRNA vaccine. The Moderna vaccine is also being produced in America. At the moment, it's given in more than 60 countries. It's being given. The AstraZeneca vaccine is given in more than 180 countries. We have also purchased another vaccine called Novavax. This is still to be approved by the Therapeutic Goods Administration. We should have that vaccine available next year. So next year, hopefully, we'll have 4 vaccines available to us. We'll have the AstraZeneca, we'll have the Pfizer, we'll have the Moderna, and we'll have the Novavax as well. Now, if we were to look at viruses, viruses tend to change, undergo changes. It's called a mutation. This happens very often with viruses. Even the flu virus, this is why every year you are given you're given a new vaccine every year for the flu as well. It targets some of those flu.
Because they're trying to work it out from an online measurement system. That's why researchers have partnered with the Australian Institute of Sport.
Again, Shivani, can you please mute Ajit? Thank you. Sorry, Mohammed.
No problem.
Please keep continuing.
So the viruses will viruses undergo mutation. And since the beginning, when we had the first outbreak of COVID, it has mutated, and we have about 11 different strains. So initially, they were classified by scientific names. Then they were classified by the country where the new mutant strains came about. So you had the USA strain, the Indian strain, the Brazil strain, the South African strain, and all that. Then 2 months ago, WHO decided to rename them by Greek alphabets. So today we have 11 strains that are we know about, as well as there are new strains that are coming. The strains of concern to us is the alpha, beta, gamma, delta. And we also now have lambda and a strain called mu. They are of concern to the WHO. The good thing about what we know about the delta strain, the good thing we know about the vaccines are effective against all these 11 strains. So both vaccines that we have in Australia are effective and works against these various strains that we have. Something to remember about the delta strain. The delta strain, unlike the initial strain, it used to take a long time to spread. You had to come directly in contact with people to be there for 15 minutes. With this delta strain, it's spreading much faster. It's like somebody needs to just pass by and you can also get infected. It is also causing more infection in children. We are seeing more children getting sick as well. And it's lots of young people are getting infected as well. So when we talk about vaccines, generally when you take the flu vaccine or any vaccine, normally your body will react. The immune system gets kickstarted. So normally you have some side effects that you'll be seeing in people. It is pain where you have the vaccine. You can feel tiredness. You can have headaches. You can have aches. And some people will have fever as well. These are some of the common side effects that people will experience. With Pfizer, they say they've seen, in most cases, it's seen after the second dose. With the case of AstraZeneca, it's normally seen after the first dose. But sometimes it can vary in people as well. But sometimes you might have no side effects. Like I have taken the AstraZeneca. Before I went for my first dose, I had all this information in front of me. I bought Panadol, I bought painkillers, I kept everything ready. I went and took the vaccine. I was waiting for these side effects to come, but I had no side effects. So sometimes in people might not have no side effects. That doesn't mean the vaccine is not working. each person can react differently. Normally in young people, because the immune system is very strong, the side effects can be seen very fast. Now, I wanted to mention, which I did not talk about initially, was the anaphylaxis reaction. This is very rare. This is like in Pfizer, is about 4.7 per million, AstraZeneca 1. But it is important for us to note this. This is like a very strong allergic reaction to something. Like, for example, the best example I can give you is peanut butter. We know some children and adults can be allergic to peanut butter. If they were to take peanut butter in any of their food, or peanut in any of their food, they would immediately react. They'll find difficult to breathe. So you give them the adrenaline, you give them a jab, they have this allergic treatment. So here, this allergic reaction, severe reaction, will occur in the first 15 minutes after the vaccination. So this is why when you go to get vaccinated, either in a GP clinic or you go to the mass vaccination site, you're asked to remain for 15 minutes after vaccination, so that if you do have an allergic reaction, they can immediately treat you and support you and get you the medical attention. Like Pasu was telling me, he took his sister 2 days ago, and he saw 2 people collapse there. They were young people, but immediately they were supported by the nurses, and they were taken into a little cubicle where they were looked after, and they were able to go home safely. So it is important for you to remain there 15 minutes for 15 minutes after the vaccination. Now, lots of people have been talking about this. This is the blood clots that people have heard about from AstraZeneca. Again, this is very rare. This is not a common thing in people. Like, it's like if you look at the percentage, and I'll show you the stats again, it's about 0.004%. Normally, this happens within 4 to 30 days after vaccination. In the beginning, people did not understand, but today we are now nearly coming to about 8 months, 9 months after vaccination. The doctors have a better understanding. We know that some of the symptoms for this is you can have a severe headache, which goes more than the normal 2 days or 3 days. It continues to be there. You can have chest pain. You can have swelling in your legs. You can have stomach pains. And you might be seeing tiny blood spots around the skin where you were vaccinated, and shortness of breath. So if you see any of these symptoms happening after like 4th day and it continues, please get to the hospital, because they will be able to treat you. So early diagnosis will help you improve. As I was mentioning, again, this is very rare. If we were to look at the clots due to AstraZeneca,
I went out and got them.
sorry.
Mohammed, can you please unmute
Yes,
yourself?
thank you. Yes, no problem.
Thank you.
If we were to look at the clots due to AstraZeneca, it's 0.0004%. People need to understand you can get clots due to COVID. The chances of getting clots due to COVID is 16.5%. So if you were to look at the benefits of taking the vaccine compared to getting COVID, you can see it's far outweighs. So it is useful to understand that it's very rare, it occurs. And in Australia, we have given, sorry, it's just, I think it's frozen me on me. Just sorry, I'll go back and come. Sometimes that happens. So in Australia, we have given over 9.6 million doses of AstraZeneca. AstraZeneca is given in more than 180 countries. In Australia, we have only had, unfortunately, we have had 7 deaths due to the clotting. So in most cases, we have had over 74 cases. Most people have recovered and been able to get back to normal life. Unfortunately, we lost 7 deaths. So again, it's a very rare occurrence. Don't get carried away what people say. There is support available. There is treatment available for this as well. Now, as we are aware, since the 24th of August, every single person over the age of 16 can get vaccinated. So people under 59 are given Pfizer vaccine, and people over 60 will get AstraZeneca vaccine. You can make your bookings and go and get vaccinated. People over 60, if they have taken the AstraZeneca vaccine and if they've had a very strong adverse effect where it has caused some problems, you can, through your doctor, apply to the Victorian Immunization Service and get a change of the vaccine. So there, it is a process you have to apply for, and you can get the vaccine change. Today, we have also approved children between the age of 12 to 15. They can, Bayatagi has approved that they can get vaccinated. But at this moment, we are only vaccinating children who have specified medical conditions that could put them at harm's risk or get COVID. So children with severe asthma, children with diabetes, obesity, cardiac circulatory congenital anomalies, neurodevelopment disorders, epilepsy, immunocompromised, and trisomy, and children of Aboriginal and Torres Strait Island. Now, the good news is from Monday next week, all children between the age of 12 to 15 will be able to book a vaccination as well. Also, from today, children in year 12 who are going to be sitting for the VCE can get vaccinated. They have a priority. There is a number they can ring and make their bookings, and they can get vaccinated as well. 70,000 doses have been kept for this particular group of children, and also the teachers who are teaching these children, plus the people who are going to invigilate their exams. So we are hoping to get these children not only the first dose, but the second dose before they go into the exam period, so they could go study properly, and they can also be able to do the exams without the fear of getting COVID as well. Now, before June, pregnant women were not offered any of these vaccines. The studies have been done world over from various key research areas as well. So now it has been found it's better to vaccinate pregnant women than them falling sick with COVID, because they can have so severe adverse effect. They could lose their babies as well. So what they have suggested is that they can be vaccinated at any stage of their pregnancy. It has also been told that we know that they can get vaccinated if they're planning to get pregnant or when they become pregnant as well. There is this fallacy saying that vaccination, the COVID vaccine, makes women and men infertile. There's no scientific evidence to show any of that. Now we are into nearly a year of vaccination. There's no scientific evidence to show that any person who got vaccinated became infertile at all. They also have suggested that if you're taken the AstraZeneca as your first dose for pregnant women, you can have Pfizer as your second dose as well. They've also found scientific evidence that the mother gets vaccinated, she can provide indirect protection to the baby fetus by transferring antibodies through the placenta or through breastfeeding as well, breast milk. Now, some people who are here are not documented. They might be refugees in Australia. So if you don't have a Medicare card, you can apply to what is known as an individual healthcare identifier. Like especially if you have international students, people here, tourists who are here, who are visiting, they can apply for an IHI. Pasu might be able to put the links to that, or we can give you the links at the end. So you can apply and get an IHI. Only difference is if you have an IHI, if you don't have a Medicare card, you can't get vaccinated at your GPs. An IHI, or if you don't have any of this, you can only go and get vaccinated at the state-run medical places like the mass vac sites. So every single person, as I said, is eligible to get vaccinated. So there are over 50 different vaccination centers in Melbourne. You can either go to the portal site, portal.cvms.vic.gov.au, or you can call the 1-800 number 675-398 and book your appointment. It might be sometimes a bit hard to get through immediately. Please keep trying. Please just bear with us, because we have had lots of people wanting to get vaccinated because of this outbreak. So we have put more staff at the call centers to answer your calls and get your appointments. So please keep trying, you will get through and you will get your appointment as well. People who have their Medicare card can book your vaccination through your GPs as well. If some people, if you know people who can't leave their home, they are unable to leave home for various reasons due to health reasons, you can, through the disability liaison group, organize for the people to come and vaccinate them at home. So that's also been offered to people who need that support as well. Now, if you have made your appointment to go to get vaccinated, but if you're feeling unwell, you have fever, or you have any symptoms of COVID, please do not go to the vaccination site. You must get tested, wait for your results. Or if you're waiting for COVID results, don't go to get vaccinated. If you have tested positive and you're isolating during this period, you should not be leaving your home and you should not be going to get vaccinated. The vaccine is not going to help you at this stage if you are infected. If you have been a close contact, you're considered to be a primary contact of a COVID patient, you must quarantine. You cannot go and get vaccinated at that time. Once you finish your quarantine period and you have come out of quarantine, then you can make your appointment and go and get vaccinated. As I said, the vaccine is not going to treat the COVID patient. It is a preventative measure. If you are going for your vaccination, you don't need to get tested for COVID. If you don't have any of these symptoms or you have not been at any of the site, you can book your appointment and go and get tested as per any other person. Now, I just wanted to talk to you about your appointment. Before you go for your appointment, if you have any questions of medical concern, please talk to your doctor. Your doctor will know what other ailments you have. They will then advise you and give you guidance of how to go about getting your vaccine. When you go to get vaccinated, please make sure you are wearing your face mask. Make sure you take some documentation, say that you have a vaccine appointment on your phone. You must carry your phone because you need to QR code at the site. You need to take some sort of identification so that they can identify you, even if you don't have a Medicare card or an IHI, some sort of identification. You might have your passport or you might have a driver's license. So you take it with you so that they can identify you, because they will also have to make that decision about which type of vaccine to give you as well. Now, once you go there, make sure you also try and make your second appointment, because it's very important to get both doses to build up to that 90+% of immunity. So please make that choice as well. So we are working with the community. We are talking to the community. We always believe that your voice is the best voice to talk to your friends and relatives and family. Once you get vaccinated, you understand better. You are also protecting yourself and your family. You can be that voice to encourage people to get vaccinated. So talk about your experience. Talk about how you went about even getting your bookings, or what things you had, what side effects you had, how you were coping with it, and all that. And we are also working with people from various communities. We are champions. We are community leaders, even people like you who want to become a champion with us, to work with us. We are also training people to understand how the vaccines work. You might not be having the scientific or medical background, but you'll be able to talk to your community, talk to your friends, talk to your family. So we are working with people. We have lots of videos from people who have had their vaccine, their experience, talking about how they're doing as well. And we're also using this opportunity to build up confidence about the vaccine. We know there's a lot of misinformation out there. We are trying to answer most of this misinformation so we can support you in being able to make the correct decision. No one is going to force you to get vaccinated, but we are asking you to think about it to keep you safe. What we want to do is keep you safe, not for you to get infected. So what is the advantage of getting vaccinated? The vaccines are effective. They stop, in most cases, the spreading of the virus. But as I mentioned, it's not 100%. No vaccine in the world can give you 100% immunity. So if you were to get COVID after getting vaccinated, we know people have got infected, but they do not get that full-blown illness. They do not end up in hospital. They do not end up in ICU. If you look at the number of cases today in hospital, in Victoria, the Premier announced yesterday, Only one person in the ICU at the moment has been vaccinated. They just had the first vaccine dose. Others have not had any vaccine. In the world, they're talking about over 95% of the people in ICU are unvaccinated people. So you can see the difference of getting vaccinated and also looking after yourself and looking after your family. The vaccine, there's again some rumors and false information out there. The vaccine will give you COVID. As I showed you, the vaccine is not made out of the virus. It is the genetic information that is taken. The vaccine cannot give you COVID. It takes roughly, it's not like a tablet that you would take, like if you have a pain, you have fever, you can take Panadol, you take Advil, you will feel better within a few hours. The vaccine takes about 2 to 3 weeks for your body to build up the immunity. It doesn't happen overnight. So this is why we are encouraging people to get vaccinated, because the vaccine is a protective mechanism to avoid infection as much as possible. But if you get it, it won't be that severe infection that you would get. If you're already infected, the vaccine will not work. The vaccine is not going to make you better or worse. So, and again, with viral infections, especially with COVID or anyone, there is no treatment. What they do in hospital is to keep you comfortable. They give you oxygen so you can breathe, you can, be comfortable. And it is your immune system, your own body, that produces these antibodies over a period of time. And they say roughly takes about 14 days for a person to recover. Sometimes it takes longer in some people, but normally it takes that 14-day cycle. Most people will recover within that 14-day period. The body produces the antibodies to fight back. So if you have had COVID, you might have immunity. Your antibodies could be there for up till about 4 to 5 months, maybe up to 6 months. So this is why people who have had COVID, we strongly recommend you to get your vaccine after the 6 months. The reason we ask you to get vaccinated, because unlike some other diseases, if you get, sometimes you get lifelong immunity, because we are talking about so many different strains. So you could have got infected by an earlier strain, and we have a new strain. So vaccination is one of the ways to prevent you from getting infected further on. So again, over 5 million doses have been given. The vaccines are safe. We have a body called the ATAGI, which are key medical experts in Australia who are world renowned. They sit and constantly monitor. They are the ones who monitor any sort of treatment that comes into Australia, whether it be a vaccine, whether it be a treatment for diabetes, whether it be a treatment for cancer, or even an antibiotic. They have to approve it, and they keep on monitoring. So they keep checking, making sure it's safe, and they will constantly monitor this. The vaccines are safe. There's very rare occurrence of any side effects. Again, as I said, talk to your GP to get your answers. Again, please be careful about what information is out there. If you want to get information, please look at websites or talk to your doctors or talk to the person from the scientific world who can give you the correct answer. There's lots of people who go onto Google, they pull out some little information from somewhere, they pull out other information from somewhere, and they try to convince people that's the correct information. That can be wrong information. So please seek that help. You can consult your friends. You might have family who are doctors or in the medical profession. Even a nurse would be able to give you some advice. Please talk to them. They will be able to help you as well. So these are some of the websites again. Thank you very much for listening. I just wanted to also end by saying the Premier said last month, there are 1 million reasons to get vaccinated. So we are trying to get as many people vaccinated. In Victoria, we have about 50% of the population vaccinated. We are hoping to get more people vaccinated over the next few months. Thank you very much, and I'm happy to take any questions.
Thank you so much, Mohammed, for a very informative session. Now, as you said, we are going forward to get the question. I can see many questions have been written on the chat box already. But before that, I would like to acknowledge Alevi Community Council of Victoria for working collaboratively with Ethnic Community Council of Victoria for tonight's information session. Thank you so much, accommodating us as well. I hope I won't miss any of these questions. If I miss it, please let me know. So I'm going to start with the first question. Just a second, please.
Susan, first question came at 6:29 from Zainab.
Yes, I'm just scrolling up and then I'll see. There you go. So apart from availability, is there any other reasons why Australia has purchased 4 different vaccines?
Okay, so the Australian government is responsible for purchasing all these vaccines. So initially they purchased only 2 of the vaccines. They had Pfizer and AstraZeneca. They're also going to use AstraZeneca, which is being manufactured in Australia. Both vaccines had to go through an approval process. It's called the Therapeutic Goods Administration. It was only somewhere towards end of January, they approved both AstraZeneca and Pfizer. So initially they started off with those 2 vaccines, and but unfortunately, although we had ordered so many doses, not all the doses were available. Then we thought we were going to be enough with those doses because we had about 50 million doses of AstraZeneca. We had about 10 million doses of Pfizer. If you look at the population, Australian population, we are about 25 million. That would have been enough, but unfortunately we had that cases of TTS. Then they changed the idea of people below the age of 50 being given Pfizer, and people over 50 were going to get AstraZeneca. So the supply was not coming. They were not coming through because we were depending on overseas supply. Those countries that were manufacturing these vaccines were also needing to supply their own population. So then the government reached out again to look at other 2 vaccines. Both Moderna is coming from America. Novavax is also coming from America. Moderna has been now it's been available to the American community. It's in more than 60 countries. So we have also purchased Moderna, which is a good vaccine. So Australian government has looked at the vaccines right across the world. They know the companies that are manufacturing. They know what are the standards that have been looked at. So these vaccines have been, now Moderna has also been approved by the TGA. Novavax is in the process of being approved. Will also be coming in at this stage. So that is why we have gone with, we cannot get enough of Pfizer to supply the whole community. So we had to go with other vaccines. And Moderna is very similar to Pfizer. It's an mRNA vaccine, which is coming from the States as well. Yeah.
Thank you, Mohammed. The next question is, what is the efficacy rate for Novavax and Moderna, and how many doses are required for each vaccine?
So Novavax, we still don't know. There's still a lot of work being done. It is not it's not being given to people as such, except in some parts of America. Not all the world is not getting Novavax. With Moderna, Moderna also has very similar efficacy, over 95% after the second dose. What is the efficacy? And with all vaccines at the moment, except for Johnson & Johnson, out of the 17 vaccines, only vaccine that needs 1 dose is Johnson & Johnson. Every other vaccine needs the 2 doses to be given.
Thanks again. The next one is, the vaccines are doing any damage to human organs?
No, none of the vaccines have been seen to do any harm. The vaccines were started to be rolled out since last October. There's been no cases of any harm done to any human organs with vaccines. Normally, we all take lots of vaccines. We take different vaccines, even the flu vaccine. It's only when people have allergies to certain components, but the components in these vaccines that we are using does not cause allergic reaction in people.
Thanks again. Why last year children were not affected by COVID-19 and this year they are getting it?
Sorry?
Why last year children were not affected by COVID-19 and this year they are getting it? Okay, so last year, even though children got it, they got very mild attack. And this, as I said, the virus has undergone mutations. So when viruses undergo mutations, sometimes the mutants are much more virulent or cause more harm. And their rate of disease and infection is greater. So if you look at the original
COVID virus, which was in 2019, somewhere in October, compared to the Delta strain we have now. The original COVID, if you, for example, in a family, if one person got that, COVID infection last year, you just have to isolate that person in the room and you could still, the rest of the family did not get it. But today, with the Delta strain, if one person in the house gets it, the whole family gets it, basically. Everyone gets infected. So, and also what we have found is with this new strain, it's causing harm in children with the new strain. So this is the variation in the strains. And as you said, it's not going to stop this way. They're going to mutate more. Like we know in America at the moment, there is a new strain called the MU strain. There's over 300 cases in Los Angeles itself. And WHO is now starting to look at that strain as well. So we will hopefully the vaccine people who are developing the vaccines will improve their vaccines to target the new strains as they come. This is what they do with the flu vaccine. Every year, remember, we get a new vaccine. That vaccine not only targets the old strains, but also targets the strains that were there in the previous year that came out. So this is the constant development in vaccine technology as well.
Okay. If I have had my first 2 doses of Pfizer, can I have AstraZeneca as a booster? Or also, how soon after my second dose of Pfizer will I be required to get my booster?
So in Australia, ATAGI, which is the body that makes the decision, at this stage, they are not approved for a booster shot. We don't think at this stage we need a booster shot. It is in countries like America, Canada, UK, and even Israel, those countries, because they started vaccinating long time before. So they are now starting, because it's nearly 9 months to nearly 10 months since they gave the original shots. So they are now starting to give people the booster shots. So we only started on the date of vaccination in Australia was 23rd February this year. We are not that long away. So at this moment, we don't think we need to be given a booster. Maybe next year, yes, we might be all getting booster shots. Or it might come to that every year we get a shot. But at this stage, ATAGI is not approving for booster shot. And okay, again, in some countries, they do mixed vaccines. They're mixing Astra and Pfizer or whatever. In Australia, ATAGI has not approved for mixed vaccine mode. But again, in cases of severe conditions where people have had a bad reaction to the first dose, they will be given another vaccine in second dose, or in the case of pregnant women where they are being given the other vaccine. But any children, all children will be given Pfizer. No child will be given AstraZeneca, because we know we don't want to even go down that 0.004% in children. We want to make sure they're safe. So they will all only be given Pfizer vaccines. Yeah.
Thank you. Another question, why we have to sign a consent form? Usually we did not sign for other vaccination. It means, I think, after getting a vaccination, why? Yeah.
I think the signing of the forms was for people under the age of 50 who were planning to take AstraZeneca, because remember at one stage, there was no Pfizer vaccine for people under 40. So there was people under 40 could not get a vaccine. So only vaccine that was then open to them was AstraZeneca. So what they wanted the people to do is seek medical advice, talk to the doctors, and then they make the decision to get the vaccine. So it's a consent form that you are agreeable to get the vaccine. But once the Pfizer vaccine is now open, there's no consent form that you're signing to get the Pfizer vaccine.
Okay. There is a myth amongst the community that COVID pandemic is the only pandemic. Can you please touch on prior pandemic and strategies that was followed?
So
to overcome and how long it took?
Yeah. So the term pandemic, so like this is me as a microbiologist talking now. When you have an infection, you talk about infection which is just localized. You talk about an epidemic, which is in a again, a little bigger, like maybe in the state, you can have an epidemic outbreak, or you talk about the country. So, or you talk about little regions that they're called epidemics. So that happens. A pandemic, when it spreads worldwide. The last pandemic we have had even Ebola, when it was, remember we had Ebola outbreak in Africa, it was not called a pandemic. The last pandemic we had was in 1918, when we had the, what you call the Spanish flu. That was the last pandemic that was there. So it is very rare for the WHO. You remember, even with COVID, it took a long time for WHO to sort of classify it as a pandemic. People were asking for it. WHO, the health authorities kept saying, no, it's not a pandemic, it's not a pandemic. So a pandemic, when it spreads worldwide and it's spreading so fast, and it's also causing deaths and it's causing a whole lot of, so the term pandemic is used when it's global. There's no single place that is missing out on people getting infected. So that's what a pandemic is. And it took us a long time. Remember, it was in 2019, somewhere in October, that we saw the emergence of COVID. It was in early 2020 or sometime early where they declared it a pandemic. So it took a few months before WHO declared it as a pandemic.
The next one is, what is the proper gap between 2 doses?
So generally, okay, I'll explain this now. Okay, with AstraZeneca, when AstraZeneca was introduced in UK, the gap between the first and the second dose was 4 weeks. They were doing it for a long period of time. Most people in UK have got the AstraZeneca because that's where it was discovered. Oxford University scientists is the one who came up with AstraZeneca. So they were giving it 4 weeks. What they found as time went by, that if they delayed the period between the first and the second dose, it gave people more immunity. So it was a matter of building up immunity. So they went up to the maximum period of 12 weeks. But what in Australia, ATAGI has done, and because we are in a case of a big outbreak, so Australian ATAGI, they have, after consultation with a lot of doctors and key medical professionals, they came down that it can be given after 4 weeks, it can be given after 6 weeks, after 8 weeks, and after 12 weeks. If there's no pandemic, like at one stage, we were COVID-free. So we didn't have to worry about, getting our immunity started very fast. So today in Victoria, the period between the first and second dose for AstraZeneca is 6 weeks. So you will, when you go to get your booking now, you will be given your second appointment at your GP or anyone after 6 weeks. With Pfizer, normally it would be a 3-week period. Originally we were giving after 3 weeks, but then we came to a situation where we were running short of Pfizer. Remember, this is one of the biggest issues we have. Our supply is not as big as our demand. So in order to get more people vaccinated, give more people a chance to get vaccinated, at least with the first dose, because you can build up to 70% immunity by the first dose. So what they did was they delayed between the first dose and the second dose to 6 weeks. So, you have more people than, looking for the second dose in the 3rd week, you can give more people and then you can shift. So today in Victoria, for both AstraZeneca and Pfizer, the period between the 2 vaccines is 6 weeks.
A lot of young people I speak to compare COVID to the flu and believe governments are overreacting. Can you please explain how they differ?
So the flu, lots of people get the flu. We all get the flu. Many of us get the flu. But this year we have not had the big flu outbreak because most of us have been indoors. We have not been outdoors. We have not been mixing with people. So the flu has not been a problem at all. But COVID is different. The flu does not cause damage. The COVID is causing damage. People who have had COVID, they say every joint of your body aches. And with flu, most people who get flu will just recover. But even with COVID, many people will recover. But look at the possibility of people finding difficult to breathe, needing oxygen, pneumonia sets in, building up of fluid in your lungs. So flu doesn't cause building up of fluid. It's pneumonia that causes the building up of fluid. COVID can cause pneumonia. COVID can cause damage to your lung tissues as well. And it can also cause damage to your various organs. So again, that level of infection, the level of damage, the level of severity in COVID is much higher than just your common flu.
How widely are vaccines available to the 12 to 16-year-old cohort across the world?
Sorry, I didn't get it.
how widely are vaccines available to the 12 to 16-year-old cohort across the world?
most-
Sorry, the reason why I asked that question is, are other countries vaccinating their young people like we are? Yeah.
Yes, the vaccination was started in America. They started vaccinating children, and even in UK. Remember, they were doing the trials in children in UK from the age of 12 long time ago. It was somewhere in March or April, they were starting to trial in UK. So in lots of countries, especially in developed countries where they have the vaccines, they have been vaccinating children over 12. Like even in America, they're vaccinating children because they want them to go back to school. They're trying to get, like I was just listening to the TV yesterday. They were talking of every day there are about 1,500 deaths, which is sad. Unfortunately, there's many people there. They are talking of 300 million people, and only 50% of people are more or less fully vaccinated. But children have been vaccinated in most developed countries because they have abundance. In the third world countries, many countries at this stage, they might not have the vaccines available. They're depending on the West, the more developed countries to provide them and give them free vaccines. So obviously the elders are being given the vaccine first. So again, even in Australia, it was not because we didn't want to give vaccines to children. We didn't want to give vaccines to the young people. We had to decide who needed to be given the vaccine, who was a person who can easily get infected. Remember, we had 1A, 1B, the different groups. So when we initially started rolling out the vaccine, we looked at people like the doctors, the nurses, the police, the people working in frontline, any frontline worker. We looked at ambulance workers. We looked at people who work in the quarantine sector. And we looked at the age people, because in elderly people, their immune system is maybe compromised. They might be having other comorbidities as well. So we needed to safeguard them. And today, what the federal government has done, a decision they have made, because remember last year, in Victoria, in the aged care facilities, we lost about 800 people died in aged care facilities. So today, what the Australian government has made, and it is compulsory, that any person who's going to work in an aged care facility, any staff member who's going to work in an aged care facility must be vaccinated. The deadline is the 14th of September. They must have at least got their first dose. They cannot work in any aged care facilities without being, because we want to protect our vulnerable. So this is why my post was shifting from the older, and then we have opened up because we have more supply. That time we didn't have much supply to work with.
Mm-hmm. What do we know about Bell's palsy and Pfizer?
It's again, people are talking about it, but it's not happening in Pfizer. Pfizer has other complications. Pfizer, you could get myocarditis in young people. It has been seen. Young people can get myocarditis or pericarditis. That's the the muscles around the heart, or the sac that keeps the heart. They can get inflamed. But good thing is no one has died. They've been able to treat. There's no scientific evidence to show that people can be affected and cause that Bell's palsy in people.
Will the side effect of the vaccinations be different if you are healthy or have chronic pains and underlying health problems like blood pressure, heart problem, and etc.?
A good question. We had people in some of my other sessions who had blood pressure, who had heart problems, who had cholesterol, who had thyroid problems. They all have taken the vaccine. There's no effect on them. And I'll give you a best example. I don't need to talk too much about anyone else. I have one of my friends who's staying with me. For the last 4 years, he's had cancer. He's on chemotherapy. He's on been on chemotherapy and all that. He took the vaccine. He took AstraZeneca with me. We have both taken the second dose as well, and we are both fine. So even a cancer patient can take. And I'll give you another example. This was the best example I can think of. I went to one of the factories to talk to the staff members there. We spoke to them, and at the end, I asked who's going to take the vaccine, who's not willing to take the vaccine. And one lady put her hand up and said she's not going to take the vaccine. She came up to me. I had a long chat with her. She explained that she had had cancer. She had had both her breasts removed. And I spoke to her, I explained, I gave her the information about the Cancer Society, which promotes the vaccination of people with chemotherapy and all that. And she rang me up the next day and said she got vaccinated. So sometimes, it's also us talking to people. People have fear. There's a lot of fear in the community. We need to be gentle. We need to be able to talk to them and support them in helping them make the, make them think. They can go and consult their doctors. They can consult anyone they want, but we can help them. We can't get angry. We should not get angry with people because it's, again, people are frightened. So people need to be supported.
Thank you. Can you please explain long COVID?
Yeah, so long COVID is, we are starting to see, this was also, it's the same thing with SARS, because when SARS took place, people did not realize that subsequently people were starting to show long-term effect of the SARS infection, because both SARS and COVID, what it does is that does damage to your lungs, because that's where the virus is targeting. That's where the virus is sitting in a big way. So it's causing harm and damage to the lungs. It's causing the scarring of the lung tissues. So what people are showing now, and what we have seen in some people, I've got a young friends of mine. Last year, both husband and wife got COVID last year. It took them over 6 months to recover post-COVID. You can have glandular fever. It's caused by a virus. People suffer with chronic fatigue syndromes. So what we are seeing, this long COVID, is where people are showing symptoms and finding it difficult to breathe. If they do too much of exercise, they're also finding those things happening to them. So long COVID is chronic fatigue, it's very similar to chronic fatigue syndrome. And we know it can also cause damage to other organs as well. So because virus, this is me as a microbiologist talking. The virus gets into a cell, it breaks it down. That's what it does. It just breaks it down. So wherever it goes and targets it and it settles inside the cell, it'll damage the cell and break it down. So this is what, even with the flu, when a doctor looks down your throat and he says your throat is all inflamed, because the virus that causes that flu has caused damage to all your cell linings. So this is just a little bit of microbiology, sorry.
Thank you. Recently, the media has been voicing all VCE students to be vaccinated before sitting their exams, and thus opening VCE Bliss this week. What happens if students choose not to be vaccinated?
Okay, there is no compulsion on the students to get vaccinated. It is a decision that they would make in consultation with their parents. But my strongest request to you is please get them vaccinated, all parents, please, because they are going to meet lots of young people. They are going to come across lots of young people. They are going to be, and young people, sometimes they have no fear. Young people have no fear. They will move around in communities as well. So this is a safeguard measure. It's a decision that you make, a choice that you make as parents as well, in consultation with your children. So, but what we are strongly advocating from the department is please get vaccinated. We want to protect a young child is our treasure. I always, for my community as well, I keep telling my community, every child is a treasure for us. We don't want to lose them. There have been young people who have died in other countries. We don't want to lose anyone. So please, I would strongly encourage you, get your children vaccinated when you have the opportunity.
Yeah, and I just want to add, it looks like most of us, we live in Moreland and Hume. And if you say in today's news, it's 94 cases alone in Hume, and some 29 or something in Moreland. I live in Glenroy. It is very, very, I had both of my jab. It's very scary to go out because a lot of people walking around in this area. So if we don't get vaccine, we'll end up in hospital, as simple as that. It's just showing there. Yeah.
Thank you, Professor. And I think this is the last question. There are still a lot of people over the age of 60 who are waiting for Pfizer or Moderna. What will be your advice to them?
My advice to them is please get vaccinated. You will have a long wait for Pfizer because we have now started the blitz with our year 12 students. We have over 60,000 year 12 students to be vaccinated in Victoria. Next week, we are starting to vaccinate our children between the age of 12 to 15. And can you imagine the number of children we have to vaccinate as well? So all the schools, every child in that age group. We also have a lot of young people who are still to be vaccinated. So if you were planning to wait for Moderna or Pfizer, that will be a very long wait. You don't want to expose yourself to COVID. It is best to get vaccinated now with AstraZeneca. AstraZeneca is a good vaccine. It's not a bad vaccine. It's effective over 90% after your second dose, you will build up. And if you look at some of the research coming out from USA, Europe and all, they say the immunity is longer in AstraZeneca. And I've heard some people come back to me and say, oh, I should have taken AstraZeneca, not Pfizer. You know, people are starting to turn around and say AstraZeneca is the better vaccine to take. So it's always this constant people. Like I tell you, when Moderna comes, people will say, I don't want Pfizer, I want Moderna. You know, it's the human nature. We go with what is new and sometimes. So please get vaccinated. It's for your safety and also it'll keep you protected as well. Next year, maybe you might decide if we have abundance of vaccines, then you might be able to get Pfizer. But at this stage, you will have a long wait to get either Pfizer or Moderna for people over 60.
Thank you so much again, Mohammed. Before I'm closing the question section, I would like to ask people who may not feeling comfortable to write in the chat box. If you can unmute yourself and ask your question to the director to Mohammed, it will be great. If you don't have any more question, then we are going to end of our session. But
sorry, Suzanne, can I just ask?
Sure, please.
Mohammed, can you elaborate a little bit more on AstraZeneca and the reason for the 60 plus as opposed to the younger? Because I think we've gotten to a point where, and I can understand some people in the community because, you know, we've had the federal health minister, the prime minister come out and, you know, warn people not to take it at one stage, and then all of a sudden we're saying you know any vaccine's better than none. But why that particular group as opposed to the younger ones? Just to like in terms of why that decision was come to, because you can understand the confusion, and that's why I asked the question about why we have 4 vaccines, because the more vaccines we introduce, the more confused people are getting.
Yeah, thanks, Zainab, for the question. I'll just go back again to when TTS started. It was in Europe. It was not here because we have not even started vaccinating at that time. So in England, this happened. And then there were cases of TTS. Because it was very new, people didn't know, and that people died. This is why I said today we know the symptoms, we know how to work with it, we know how to save people. When it happened in UK, what the United Kingdom did was they made anyone below the age of 30, they said anyone below 30 will not be given AstraZeneca. It's only people over 30, sorry, yeah, under 30 will be given Pfizer, over 30 only will be given AstraZeneca. Australia went with a more conservative attitude and said anyone below 40, initially, remember it was 40, anyone below 40 will be given Pfizer, anyone above 40 will be given AstraZeneca. As time went by and they saw there were few cases where people between the age of 40 to 50 were starting to develop clotting. And this was mainly in women, not in men, mainly it was in women. So then as Atagi made the decision saying that we now, in order to safeguard even those lives, so we will move towards having people 50 and above getting Pfizer, people 50 and over getting AstraZeneca. Then we had few cases that happened again in women, mostly it was women, who got the clotting who were in the age group of 52 to 54. That was what was happening. And this is why I keep telling people, it is good we have a body called Atagi. This is world scientists, medical experts of Australia, who also have world reputations. They monitor all this information that continuously comes to them about these vaccines and the side effects. They make decisions. They could have taken the decision and said, look, let's just keep quiet. Let's go with what is available 50 and below and 50 and above and all that. But because they have a role to play, they are not the government does not control them. The government does not make decisions for them. They make the decisions, independent decisions for the people based on health aspects. So they then made the decision saying, because of this situation that we had two women who died in the age of 50s. So they then moved the post to saying anyone above 59, and there's very rare chances of older people dying of clotting due to AstraZeneca. There have been one or two cases. I'm not saying there haven't been, there have been, but majority of the people are in the ages below 60, especially in women. So they moved the milepost to say anyone below 59 and below will be given Pfizer. Anyone over 60 gets AstraZeneca.
Thanks again, Mohammed. Is there any more question to Mohammed? I can't see anyone is going to ask you a question. So thank you once again, Mohammed. Thank you so much for informative session tonight. And also, we just shared our survey, which is questionnaire through chat box. Please, before you leave, just fill that questionnaire, then we can just identify the problems and hesitancy from the CALF community and pass on to the government. It will be much appreciated from us.
Thank you very much for listening to my talk, and also thank you very much for participating. It was fantastic, I think. And thank you for giving us this opportunity to come and share some information about the vaccines. Please do get vaccinated. We can all be safe, and you know, that's the main thing, to keep our families, keep ourselves, families, and the community safe is the most important thing.
Thanks. Thank you so much, Mohammed.
Thank you.
Please take care of yourself and have a lovely evening.
Thank you. You too.
Thank you very much.
Thank you, everyone.
Thank you.
Thank you
Thank you
for
very much.
organizing.
Thank you. We'll see you
You're
again.
welcome.
Thanks.
Bye-bye.
Yeah.